Hi, I'm Brent Stafford, and welcome to another edition of Reg Watch on GFN.TV. The UK government is pushing ahead with its landmark proposal to ban the sale of tobacco products to anyone born on or after January 2009. While the goal of creating a smoke-free generation may sound laudable, the Tobacco and Vapes Bill also introduces sweeping new restrictions on safer nicotine products, including potential bans on flavors and vaping in outdoor spaces. These measures have alarmed the UK tobacco harm reduction community, and for good reason. What's unfolding in the UK is not an isolated policy debate, but part of a broader push across Europe to regulate safer nicotine products as though they are just as dangerous as smoking. Joining us today to unpack the UK's Tobacco and Vapes Bill and to explore its connections to the growing threat to vaping across Europe is Martin Cullip. Martin is a writer, tobacco harm reduction advocate, and an international fellow at the Taxpayers Protection Alliance. Martin, it's great to see you again. Thanks for coming back on the show.
Yeah, thanks for inviting me, Brent.
So let's start with the UK. The Tobacco and Vapes Bill was first proposed in 2024 and passed third reading in the House of Commons last March. So where are we now in the process?
It's currently in the House of Lords, and it's going through report stage. So they're going through some amendments. Most of the amendments have no chance of succeeding, but it is interesting that the government itself has proposed some amendments which will get through, I expect, and some of them were actually talked out when MPs were talking about what should be in this bill. Most notably, for example, there's going to be an exemption to the ban on vending machines for those that are cited in mental health institutions. Now, this was a suggestion that came up during one of the readings of the bill with the MPs, and there was one particular MP who talked it out and said, no, if someone is in a mental health institution and they want to vape, they should go to a shop like everyone else. And she also said that it'd be really bad because nurses also work in these mental health institutions. What if they got hold of a vape as well? That was kind of the attitude that they were dealing with. A complete lack of empathy for people in those institutions, and this idea that somehow vaping is as harmful as smoking, which isn't the case, obviously. But the good thing is that someone has obviously been speaking to the government and saying, of course you're going to give an exemption for vending machines in mental health institutions. It's public health professionals who are asking you for it in the first place. It wasn't industry. So someone has been talking to them. They've also got an exemption, for example, on advertising for vapes from public health organisations. They said we're going to ban all advertising these products, forgetting that public health want to say to smokers, move on to vapes rather than smoking. And if they can't say that under the ban that the Tobacco and Vapes Bill was proposing, then they're stifled just as much as anyone else. So, I mean, it's good that someone is talking to them, but at the same time, I think it shows how ill thought out this bill is on the side of the vaping restrictions.
Now, does the bill do, say, what Canada's regulations do, and that is from the outset deem the products to be a health hazard?
They're very careful to say that vaping is much less harmful than smoking, and they say that they want to balance the legislation so it doesn't dissuade people who smoke from quitting to vape. So we have the Swap to Stop campaign in the UK, which the government is giving away up to 1 million vapes to smokers to help them quit. So they do pay lip service to that, but at the same time, there's this element. I think it's driven by the MPs, because the MPs are as misinformed as the rest of the public in the UK, who seem to think that vaping is as harmful as smoking, which of course we know is completely untrue.
Now, is the ban on disposables that went into effect last year, is that a part of this bill or something separate?
That's slightly separate. That was something that went through the Department of Environment, Food and Rural Affairs, DEFRA, and it was solely on the environmental impact of disposable vapes. So that was slightly different. It's not under the Tobacco and Vapes Bill, no.
So how is that disposable ban actually working out? I'd imagine no more teen vaping in all of the UK.
Well, it's I don't know. It's hard. You're getting mixed reports, really. Industry are saying that people have moved on to refillable, rechargeable devices, and public health, well, like they want to say that the disposable ban is a great idea, so they're saying that as well. But you do hear anecdotal evidence that people are still getting hold of disposable vapes because there's still a demand for them. The difference is that now the legal market is banned. If they want to get their disposable vape, they're going to get it from illegal sources. So we don't know. I think generally it's been something that has gone fairly okay. But you do hear voices on the other side saying, well, we banned disposable vapes, but they're selling these refillable vapes and they're the same price, which kind of betrays some of these people, they weren't really interested in environmental concerns. They just wanted to ban these vaping products.
Stepping back, Martin, what's most concerning about this bill for tobacco harm reduction?
It shouldn't be a tobacco and vapes bill to start with. It should be a tobacco bill and a vapes bill. If they want to tackle vaping, then they've got some ideas. They want to stop youth vaping. They want to stop people who haven't vaping. Pretty pointless kind of thing, really. But yeah, if they want to do that, they've got some ideas in there. But it's like using a sledgehammer to crack a nut. It really is, and they're talking about banning certain flavours. They're talking about putting products in plain packaging. They're talking about including vaping into the general smoking ban. So I think it was last week or just over a week ago, the government announced a consultation where they're going to ask whether places that are smoke-free under the smoking ban should also include vaping products. And there's absolutely no justification for that whatsoever. Not even a scintilla of evidence to say that a vaping vapor can harm bystanders. So just today, actually, as we're filming today, I noticed the New Nicotine Alliance has produced a briefing which gives 10 good reasons why the vaping ban is a terrible idea, which it is. It's illiberal, it's unjustified by any science, and it's going to cause more harm than good. It'll dissuade people from quitting smoking and using vapes. It's going to pass a message to the country, which is already badly informed, that vaping is as bad as smoking, which we know is not true. It's orders of magnitude less harmful than smoking. And it can only do more harm than good. But I think people need to respond to that consultation if they're in the UK or elsewhere. I presume. I don't know if it's if something's restricted to the UK, but the NNA has been trying to get people to respond to the consultation. I know some libertarian people like Christopher Snowden have been putting their oar in, but I do sense there are people in public health as well who are not very happy with some of these regulations, and they can see that this is going to basically promote smoking. It's pro-smoking legislation. Everything you do to restrict vaping is going to give an advantage to combustible cigarettes. So I think there are people in public health who recognise that. So hopefully they'll speak up as well, and at least this vaping ban could be headed off. But there's going to be many consultations to come on all the other aspects. But what is most worrying about all of it is none of this now has to go through Parliament again, because the Tobacco and Vapes Bill is kind of an enabling act. It says that the Secretary of State for Health now has the power to do whatever he wants. So it gives one person, without any nod to parliamentary process or MPs having their say, he can just decide one day, I'm going to have a vaping ban, or I'm going to ban all flavours except for tobacco, just because he feels like it. And it doesn't matter how much opposition you get. I call it an enabling act, and we know enabling acts were used elsewhere in Europe in the past, and it just seems like that to me. I don't think it should have been done like that. It should. With the smoking ban, we had weeks and weeks of consultation and discussion, and MPs were given a free vote. With this one, it's just one man can decide it, and I think that's a really bad way of doing legislation.
Now, I mean, in Canada, as an example, Health Canada received a ton of powers when the Tobacco and Vaping Products Act was enacted here. But when they do new regulations, there's a certain amount of consultation, at least consultation process that they have to go through, and they have to make some rationalizations. However, though, it does appear that they can just bring new regulations in pretty easily. Is it something even more draconian in the UK, where just that one Secretary of State for Health could just decide and implement?
Yeah, they've said all the way through that they're going to consult on all of these things, but you and I know the form of public consultations. I think they were brought in this country during the Blair government, I believe, and I've not known many of them that actually change course and end up in a U-turn. Hopefully, it will with the vaping ban anyway, but. They're generally, I wouldn't call them public consultations, I'd call them public sector consultations, because you can have all these NGOs that the government pays for to lobby the government end up having their way no matter what. And but this tobacco and vapes bill, reading the impact assessment, especially on the plan to ban vaping and add to the public smoking ban, it's an absolute mess. The people who wrote it, the civil servants, I mean, it's almost like they didn't know what they were doing, or maybe they didn't believe in it, or whatever. I mean, for example, there was one clause in there said that we have absolutely no evidence that heated tobacco vapor can cause any harm to bystanders, but because it contains tobacco, we assume it will. I mean, you can't have legislation based on an assumption just because well, it's got tobacco in it, so it must be a bit like a cigarette. I mean, that's the kind of level of thinking that's gone into this thing, and you do get the impression that the anti-vaping sections of the bill are just basically prejudice and snobbery from some MPs and some of the people on the government who just don't understand what they're legislating. I mean, if they'd have only spoken to consumers when they had the evidence gathering sessions, which they didn't, if they'd spoken to industry, which they didn't, maybe they'd understand a bit more. But they purposely left out those people so they wouldn't hear any views that they didn't like to hear as they prepared the bill.
My, how far the UK has fallen.
Well, yeah, it has to be qualified that we are living at the moment under a government which apparently polling has said is the most unpopular government in living political history. So, but you just wonder why do this now? We have 5.6 million vapers in the UK, and they're polling so low. They tried to cancel elections because they know that they're going to get wiped out in the May elections, the council elections. Why pick a fight with 5.6 million vapers when you're that unpopular? You'd think they'd want to curry favour with them, but who knows? Who knows what this government is doing at the moment?
So this extension of the smoke-free policy basically means that everywhere cigarettes have been banned, vaping would now be banned too as well. And that would especially cause some problems, wouldn't it, for those 5.6 million vapers in the UK, because it kind of would kill, have a vape and a pint on a patio pub.
Yeah, exactly. But they've said that they're going to keep, like, this is what I said about paying lip service to the idea that smokers can switch to vaping. They said no, but we do want to emphasise that vaping is different from smoking. So what we're going to do to keep this difference, we're going to ban smoking in the grounds of hospitals, but you can vape there if you like. So, I mean, how that is like keeping the difference between vaping and smoking, I don't get it. It seems incoherent, the whole thing. And I mean, what they're aiming to do, I don't think they even know, to be honest.
It kind of feels that they're denormalizing vaping in the UK.
That's kind of what they've said. They don't want to normalize people vaping, but if you're encouraging people to vape, you're denormalizing smoking. You're saying, this is better for you. But they seem to want to say that, and they say on all their messages, we don't want to stop people quitting smoking for vaping. But at the same time, they're attacking vaping. I think the lack of understanding, I think, shows itself most when you come to the Swap to Stop campaign. You've got one arm of government. This is something the NNA briefing mentioned. One arm of the government is saying we want to give smokers a vaping product, so they switch to vaping instead of smoking because we know smoking is very harmful. But at the same time, we're going to denormalize vaping and say it's not acceptable in society by banning vaping in public places. I mean, it's one side of government arguing against another side of government. I don't think they really have worked it out. They haven't thought it through at all. I don't really know if they've worked out what they're supposed to be doing with it.
So, Martin, you've mentioned that this new vapes and this tobacco and vapes bill kind of contradicts previous government guidance because, of course, Public Health England was very supportive of vaping, explicitly warned against treating vaping the same as smoking, yet this seems to exacerbate the public misperceptions of harm around vaping.
Yeah, and that I think is the most striking thing. They've gone against all guidance that they've been given by government commissioned reports. They commissioned PHE, Public Health England, to do research into this. I think Public Health England did about 6 different reviews, and all of them came out with guidance on vaping, which now the government seems to have completely ignored. Javed Khan, in his independent review, had said that vaping should be promoted at all costs to get people off of smoking. They've ignored that. They've ignored with the vaping ban. They're ignoring Public Health England saying that it's not acceptable that vapers should have to go out to smoke in the same place as smokers do. They've abandoned that. And you think, well, why pay taxes? Why pay our taxes for these government commission reports if you're just not going to listen to them? The whole thing is kind of a mess. Like I said about the impact assessment, everything about it is a mess. Nothing seems to be buttoned up. Nothing seems to be controlled. Nothing's coherent. It just seems to be throw something at the wall and see what sticks, kind of thing. It does. It's very baffling when you have to read these articles and listen to MPs talking and think you really haven't got a clue what you're doing.
Martin, there was a data point in some of the materials that I was going through in prep for this episode that said that 56% of the public incorrectly believe vaping is as harmful or more harmful than smoking. But the kicker is that with the highest misperceptions among smokers who have never vaped. Why is it that smokers who have never vaped seem to believe that misperception the most?
Well, if you're a smoker, I suppose it's natural that if you don't want to quit, then you would sort of seize upon any evidence to say, well, I don't want to quit to them because they're obviously as bad as smoking. But this is a massive failure of public health, because public health are not emphasising enough the difference between vaping and smoking, and politicians with these new rules are going against that. And what you're going to see is that gap of understanding is going to grow. There are going to be more smokers who are going to believe. Imagine if they add vaping to the smoking ban. Well, firstly, smokers are going to think, well, there's no advantage anymore, because if I switch to vaping, I can't vape indoors. I have to go outside. I may as well smoke a cigarette. And this again is a lack of understanding from politicians, because if you have to step outside to have a cigarette, the cigarette is the most efficient way of getting nicotine. It gives you a massive blast of nicotine. You can have a cigarette in 5 minutes, go back into a pub or an office or wherever, and then forget about nicotine for an hour, 2 hours even. But that's not how vapes work. Vapes work because it doesn't deliver nicotine as well as a cigarette. So it actually gives an advantage to cigarette smoking over and above vaping. So including them in the same laws is actually pro-smoking legislation. It's actually encouraging people to smoke. And again, I don't think these politicians have done this deliberately. I think they just haven't got a clue what they're doing, and they will not have a clue what they're doing because they didn't listen to the people they should have been listening to, but they didn't want to. So that's why we have this incoherent mess, and it's going to do, like I said before, much more harm than it will do good.
So is there any possibility that there could be some real change then made to this bill?
No, not really. I mean, it's got widespread support, cross-party support, so I think it's going to go through no matter what. It's good that the government is considering some new amendments, which means they have been listening to someone. They're listening to someone in public health. That's good, but this is on the margins. This is only small cosmetic details they're going to be changing. The main thrust of the bill is going to be ostensibly, they're saying we want to have a generation when no one smokes, and we're aiming to stamp out smoking for good. But what they're actually doing is just saying all the alternatives are just as bad as smoking. You may as well carry on smoking, as far as we're concerned. That's what the legislation is going to send a message to the public on.
Finally, on this issue, is there anywhere you can point our viewers to go to get more information if they want to try to help out?
I'd just say, and as Clive Bates often says, just keep an eye on what your consumer associations are saying, even sometimes what industry might be saying. But the NNA New Nicotine Alliance has published a very good briefing today. Try and find the NNA website, look at the briefing, and it guides you to the consultation so you can have your say. And keep an eye out for the future, because that won't be the only consultation. The one on just on banning vaping in public places is just one consultation. There'll be one on banning certain kind of flavors, but there'll be one on putting things in plain packaging. There are a number of consultations because the government said they will consult on these things. And if you don't have your say and you don't register your complaints about these things, then they'll just do it anyway. So at least have your say, submit to the consultation, see what people who know what they're talking about are saying, and go with the evidence. Because the government hasn't really got any evidence at the moment on some of these things. You have to tell them that they're doing things wrongly, and you have to tell them that these products are helping you to quit smoking, they're helping you stay off smoking, and they should leave them alone.
Martin, you'll be hosting a session at the 13th edition of the Global Forum on Nicotine, the annual conference on safer nicotine products and tobacco harm reduction, taking place again this year in Warsaw, Poland, from June 3 to 5, 2026. Martin, your session is about how multinational organizations constrain national sovereignty in tobacco harm reduction policy. Without giving away the store, what will you be talking about?
Well, it's mostly about how groups like the WHO and the EU Commission are kind of railroading national governments and trying to interfere in their sovereignty and what they can decide to do on tobacco and nicotine policy in their own countries. We saw that at COP11, Conference of the Parties with the World Health Organization, where they were trying to sort of browbeat countries into having forward-looking measures on all these new nicotine products. They're trying to equalise them with smoking and treat them all the same, put them all in the same box. And you're seeing the same thing with the EU now. They're approaching their new Tobacco Products Directive review, TPD3, and they're trying to railroad the 27 member states into passing legislation which will do the same thing, equalise heated tobacco, vapes, nicotine pouches into the same regulations as smoking. So it's high taxation, plain packaging, bans on where you can use them. They just don't like these safer nicotine products for some reason, and you can only wonder what their justifications are. But it's where these countries. We noticed this during COP11 in Geneva, where the number of countries that stood up with their country statement and said, in kind words, diplomatic words, look, this is our sovereignty you're talking about. We would reserve the right to treat these products how we would like to treat them. It's not the WHO's job to try and tell us what to do. The WHO didn't like that. They didn't get consensus on some of the things they wanted to get consensus on. And they've got to go back to the drawing board for COP12. But the number of these countries saying sovereignty actually matters to us, and it's not up to you to tell us what to do, at both WHO level and at EU Commission level. WHO like to say that their things are binding, what their decisions are binding, but they're strictly not. But it's done on pressure. They could say, well, you were in the room when we decided this, so therefore you really should put it into your laws. But when it comes to the EU, if it's a directive from the EU, it's legally binding on 27 member states. So, and I think there is a bit of pushback on the EU level, because you have a number of states. I think about a third of the states are saying, look, leave us alone. We don't want you to tell us what to do here. But that's what our session is going to be about, and say, are these multinational organizations, are they overreaching? Are they, they're going outside of their boundaries and trying to do things they shouldn't be doing? And our countries get fed up with it, which they should be. If they're not, then they're probably doing something wrong towards their own populations.
Yeah, there was a little bit of a debacle there for the EU at COP11 because they weren't able to put together the common position that they would be able to take to the WHO. But the EU also was moving to overhaul its tobacco taxation directive to impose minimum excise taxes on safer nicotine products like vapes and pouches. What exactly is being proposed there?
Yeah, they wanted to have minimum taxation for cigarettes, but also for vapes, heated tobacco, and nicotine pouches. And the significant thing about it was the biggest increases were on nicotine pouches, which are probably the most or the safest nicotine product that there is really. And why they would want to massively ramp up those taxes is anyone's guess. We have an example in Sweden, in a country which is it's almost, I think it's almost, it might even be smoke free already, 16 years ahead of the EU's target of the year 2040. And no one seems to be looking at Sweden. Instead, they're trying to drag Sweden into the net of this thing. And it came out recently that the EU wants to impose tax on snus. Now, how can they impose tax on snus? Snus is banned across the EU. It's only allowed in Sweden. But the EU is saying, well, Sweden, as you allow snus, we'd like to take your tax from it. How hypocritical is that? They're trying to take tax of a product that they have actually banned. I mean, this is unheard of in any regulatory area. You can't. It's simply not right. You cannot tax a product that you've banned. It can't be done. You've made it illegal. It's illegal people supplying it in much of the EU. You can't then turn around and say you want to tax it. The whole thing is, I don't know. Like I said, you cannot guess their motives. Why are they so determined to destroy these products that are saving people's lives? Only they can answer that, really.
And alongside that tax overhaul, there's also the proposal that would require member states to send 15% of their tobacco and nicotine excise revenue directly to the EU as general revenue. That's extraordinary.
Yeah, that's the TEDOR, TEDOR requirements. Is Tobacco Excise Directive Own Resources, I think it's called. And they're basically saying that what countries have got to do, they've got to impose tax to a certain level and then just give 15% of that taxation income to the EU. And of course, that's struck a bad chord in many of the member states. I think there's something like 14 member states, a majority of the 27, who've said, no, it's none of your business. How dare you try to take our taxation from us? But the EU wants the money. They say that they reckon they could gain, or they can raise 11.2 billion euros from this, and it just seems to be solely about money. The EU just want to have a tax grab and take money off of the member states. I'm not sure how far that's going to go because it's got a lot of opposition, but it's still astounding that they're even proposing it.
I want to share with you and our audience a troubling video out of Ontario where multiple vape shops have been targeted by arson or attempted arson, with at least 5 incidents in just the last 3 months, with 2 arsons occurring just minutes apart in the early morning hours at separate vape shops on the same street. You can see here in this video the person breaks into the shop, pours gasoline all over, then dips out and tosses some flash paper, and whoosh, it goes up in flames. Shop owners and police emphasize these were planned attacks, not vandalism or accidents, and vape shop owners publicly state they believe the attacks are tied to organized crime and the illicit vape market. Martin, looking at this, I can't help but ask whether high taxes and market restrictions could be contributing factors. What do you make of this?
Yeah, well, this is just the result of ignorant policymaking, isn't it? We've seen this in Australia. I think Australia's had about 300 fire bombings. I think 7 deaths as well as a result of these things. And I've heard that they have shops that are tobacco or vape shops and they're getting firebombed, and now insurance companies won't insure not just those shops, they won't insure shops that neighbour them or along the same maul, if you like, because they're scared of the attacks that are happening. And in Australia, what has happened is they've unrealistically raised the tax on tobacco to a ridiculous extent, and people just don't want to pay that anymore, so they'll buy it off the black market. And what they've also done in Australia is they've banned vaping products, so it's not even like there's a get out for smokers. They can't just go on to something less harmful. And when you do that, you don't get rid of the demand for nicotine. People have used nicotine for thousands of years. They'll always want to use nicotine. What you do instead is you create massive markets for illegal sellers, and criminals take over the supply. You've lost control of your tobacco and nicotine policy. And it seems what we've seen in Australia, and even in Australia, even anti-smoking organisations are now saying, well, maybe the tax is a little bit high. We're creating like lawlessness here. If we're seeing that in Canada, it should be very worrying to the Canadian authorities.
Finishing up then again with the upcoming Global Forum on Nicotine in Warsaw, the conference theme this year is prohibition and public health. In your mind, what are some solutions to address how prohibitionist thinking has come to dominate public health policy around nicotine?
Well, it always strikes me as absurd that people in public health seem to want prohibition all the time, because we know prohibition doesn't work, and we know that prohibition is not good for public health. It's as simple as that. You go back to prohibition in America with alcohol. What happened? You instantly had a massive black market. Everyone's seen the gangster films. Everyone heard of Al Capone. Was that good for public health? Absolutely not. But we seem to have these people in public health who just can't see past prohibition. And no matter how many things happen, the fire bombings that we talked about in Australia, the film that you just showed from Canada, these people are seeing the same things. I mean, they must see these same things because they're in that policy area. They must be scanning these things just like I do. And yet they seem to just put those things out of their mind and go for prohibition anyway. So you have to think, as I said earlier, what are their motives? It doesn't seem to be public health. It seems to be just what they want. And it's hard to think, well, maybe they're just interested in their own wallets and what grants they can receive and their own status, their power, their livelihoods. Is that what they're thinking of? Because it certainly doesn't seem to me that they're interested in public health.